Hey, everybody. I am Dr. Andy Roark, and this is the Uncharted Podcast. Guys, I'm here today with my friend, Monica Dixon Perry. She is a world-renowned practice management consultant and a friend of mine, and she is going to be speaking at the Uncharted virtual Get Stuff Done Financial Edition conference that we have coming up. It is a one-day virtual program. It is on October the 29th. If you are a practice manager, inventory manager, office manager, a practice owner, anybody who is in on the financials of the practice, this one-day event is for you. That's what it's all about. I would love to see you there. Monica's going to be speaking there, and we talk all about that a little bit when we get up and started. And so anyway, that's what she and I are working on together right now. And I said, hey, why don't you do this podcast with me? And she was like, all right, I'm in. And so we have a question from the mailbag about a potentially money-hungry doctor. We have a veterinarian that's taken all the cases and stuffing extra cases in on top of a full schedule. And then also they are turning in invoices that are higher than the other doctors consistently. And it's not that they're using medications or things that are wrong. It's just they're using more expensive medications than other people, for example. What does that mean? How do we know when we have a problem with production-based compensation in a veterinarian? That's what we get into today. It's a really fun conversation. Let's do this thing.
And now, the Uncharted Podcast.
And we are back. It's me, Dr. Andy Roark, and the one and only Monica Dixon Perry. How are you, my friend?
I am doing absolutely marvelous. Enjoying this nice weather.
It is wonderful fall weather right now. It's just absolutely gorgeous. For those who do not know you, you are a veterinary management consultant with BerryDunn. You are a lecturer. You are an advisor. You are someone who I have loved working with over the years. You are speaking at the Uncharted GSD Financial Virtual Summit. It is on October the 29th, and you are doing our general session, which is effective veterinary financial management and analysis. And you're going to be talking about sort of inventory management and sort of the operation sort of side of the business. Can you speak a little bit about that? What are you excited to talk about?
Inventory is a topic that probably a day doesn't go by that I don't speak to a client or answer email about. Having been a hospital administrator, had to oversee inventory for a number of years, and now, as a consultant advising folks, I love the fact that the numbers part and putting a square peg into a round hole. I feel like that's how sometimes people are approaching inventory. But when you can bring it all together and it's running like a well-oiled machine, when, your costs are not exceeding those benchmarks and people are happy, the clients have what they need, the doctors have what they need, that's like the best scenario. So I'd love working with clients and helping all of those pieces of the puzzle come together, because I know that inventory is a challenge.
That is fantastic. I love that you do that. And again, I love that you'll be talking about that on October 29th. There's still seats available. You guys can hop on from home and check it out. But it's going to be a whole day full of action-oriented programs around the financials of the practice. That's something I'm really looking forward to. Monica, I have got a question in my mailbag, and you are a experienced, dynamic veterinary management consultant, and I was wondering if you would look at it with me. Is that okay?
Sure. Happy to.
Outstanding. I got a message, and it is called, "Do I have a money-hungry vet?" That was the subject. And so here it is. So our doctors are paid on a pro-sal model. So they're getting paid on production above a base salary. Our top producing DVM is starting to get a little nuts on scheduling up to 6 additional appointments on top of a full schedule, taking as many of the medical admits as possible and seemingly choosing more expensive medications. It's not bad medicine, but it's becoming an uncomfortable situation with some of the assistants and staff. We have protocols that allow for doctors to choose their medications of choice. How do we start to address this? How do we ask a doctor to scale back on number of cases each day? And so that's the question that we got. From a headspace standpoint, if you were going to coach someone who is going to go and engage with this doctor, what do you try to get them to remember? What do you think about philosophically before you engage with a challenge like this?
Right. And I would say that first for me, it's always taking a step back and trying to figure out why this is happening, because it sounds like it's a new problem. As a consultant, I can probably shed some light on the industry as far as volume. We've seen a decline, not as many invoices that are being generated. And obviously owners, managers, they know this, they feel this, but rest assured, our associates feel it as well.
Yeah.
And when you're paid on the pro-style method of compensation, although there's that guaranteed base, realizing that when you're not as busy, that second check or commission check, it does take an impact where if you're not as busy, you're not generating as much revenue. That second check may not be as much as what you've been accustomed to, especially coming out of COVID. So for me, it's taking a step back and knowing that there is probably a little bit of fear, anxiety there. And I think that instead of putting a Band-Aid over it by pulling them aside, you can't do this, you can't do that, you've got to get to the root of the problem. I don't like to approach things from a Band-Aid perspective. I like to, as you doctors would say, we're going to get to that wound, debride it, clean it, and let it heal from inside out. So I would speak to that doctor and just have an open talk, get to what the concerns are, and then go into some of the things that we need to do to address those concerns so that we can reassure him or her that we hear you, we know where you're coming from. And then probably go back to some of the core values of the practice, that we're not going to pad invoices, we're not going to take advantage of any situation. We are the pet's advocate. We're advocating for obviously everything that's in the best interest of that situation, and that there's no reason for us to feel like we've got to steal cases or pad invoices or anything along those lines. As a former administrator, the practice that I used to manage, we were a 9 DVM, 7-day-a-week Eastern Western practice. So you can imagine in a very busy practice, you would think that there are not times that you have to be, I guess, anxious to be busy. They were all busy. Yeah. But there are times, certain times of the year before COVID, there was more of that seasonal. It would slow down in the fall and winter months and then, pick up during the summer months. So that little bit of anxiety that this doctor probably is experiencing, I had to deal with that. So we would do things strategically to combat some of those concerns. So for me, I think whether it's in your personal life or your professional life, if there's an issue, you got to take a step back. As my father taught me, you look at things rationally, not emotion. So take the emotion out of it and then kind of go from there.
I love the idea of taking the emotion out of it. I would sort of dovetail on to your sort of starting with sort of understanding what's going on and say, I try to assume good intent. I don't want to tell myself a story, this doctor's running up the invoice or this doctor's money hungry. It's like, I don't really know. Maybe they think that they're doing something that's good for the practice. Maybe they're trying to be accommodating. As you said, everybody's fighting a battle that we don't know anything about. Mm-hmm. It makes everything easier if I assume this is a good person. Let's figure out what's going on. And we might need to put some guardrails in place. But I hate tagging someone and saying that person is a money chaser, because once you sort of tie them and say, that's who this is, there's no wiggle room. And so let's try to assume good intent. Let's try to lower the stakes. And I want to fix the behavior. And it's going to be easier for me if the person doesn't feel like they're being judged or this is, a high stakes conversation about their clinical ethics.
Right.
Look, let's just talk to them and sort of see what's going on. The last part of sort of the headspace around this as well, and I think you sort of touched on it when you talked about sort of core values, I think we really kind of have to think about the impact here. And so this person is taking all these cases, and so they're, taking 6 additional cases on top of a walk-in. What is the problem, to the managers is what I would say. I'm sure there are problems. Is it that the staff are overwhelmed? Is it, is it that the other doctors are resentful that they're not getting to see these things? What is really the impact of this behavior? Because ultimately I want to talk to the person about that impact and sort of say, hey, look, when you take these extra cases, it's really putting a load on the support staff. And we know they're saying, we're taking these half dozen extra cases on top, and it's not sustainable for them. And again, see what the person has to say. If they're saying, look, I don't want to turn people away, I want people to get care, I can't be mad at them.
Right.
But also, we might not be able to take 6 extra cases, on sort of on top of what they're doing. And so that's, when I think about sort of the headspace and sort of what I'm trying to do, I think that's sort of the big thing for me, sort of philosophically. I'll give you one other thing, and I don't know if you've sort of talked about it this way. One of the things I call out in philosophy is looking at these cases as well. One of the things that's important is to recognize what is a problem and what is a perception problem. Mm-hmm. And so it might be, so we're talking about the medications, for example. It might be this doctor is like, this is what I learned, and this is what the new research is sort of saying this, or this is what I believe, or I think these are the best medicines and things like that. And that can be true. I don't want to get into an argument with the doctor about the medicines that they're prescribing.
Right.
I think that I can make the point to them, hey, I'm worried that the staff is seeing this and they are seeing the invoices and they're very different from the other doctor's invoices. And there is a perception that we're either padding the bill or that this is more expensive than it needs to be, or that it's really straining the pet owners. What do you think about that? I guess, what do you think about that? And sort of try to frame it that way about, I'm not saying you're doing anything wrong. My concern is the way that it's being perceived by the team. And sometimes that's an easy way to not say you're wrong and I'm right, but just, this is how I worry the team is seeing it this way.
Right. And I think it is perception that needs to be taken into consideration. As a DVM, as a manager, former manager, consultant, we have a bigger idea of what the picture may be. And it could be that our doctor was on VIN over the weekend, or they spoke to some of their colleagues, or they came back from a conference. They have access to a lot of information, and it may have been something that they read up on or got some feedback on as to why they are moving in this direction. And I understand that things can come across that way, but sometimes our team members may not be able to appreciate that or empathize with it. So I think it goes back to communication. If you are a doctor that's going to start prescribing, it's kind of like our inventory managers. They're like, why did Clavamox or whatever drug become the drug of the choice for our doctors this week? Where did that come from? I haven't had to order it as much. And whatever the reason may be, I think that doctors, it would be resourceful if you conveyed that to your team members to say, hey guys, I heard this weekend about XYZ drug, and if you see me prescribing it a little bit more. That's easy for me to say, being on the outside looking in. As a DVM, you may not even realize that you're doing that. But I think if there's open communication to say, that the manager or the employees have the comfort level to say, hey, I noticed that you've been prescribing XYZ a lot more. Is that something that I need to convey to our inventory manager to order it? So it's like you're learning. But, it's all about the psyche. We're manipulating the situation to find out what's going on here. And it could be nothing more than, I read something, I want to try this. And it's like, oh, that makes sense, versus the perception is that you're prescribing this expensive drug and I'm the one that's having to go over it with the client and go over the estimated costs. And I'm getting a lot of pushback. So there's always two sides to a story. And I think that realizing that, that the doctors have to understand the story that the receptionists or CSRs are dealing with is going to be different than how it's perceived from their standpoint. And that's why I'm a strong advocate for what is called cross-familiarization. It has not made it to the Webster Dictionary yet, but it's a term that I used way back when I was in private practice, and I would have my CSRs shadow the doctors for a day, the techs for a day, so that everyone got a better understanding and an appreciation as to, oh, that's why this receptionist or CSRs will come back and ask this question, not to hound us, but it's because someone is asking them a question they need to follow up. For the team members to have a better appreciation, I think that's where the perception can get us in trouble. And we're a team and we should be communicating openly so that we have a better understanding of why someone is doing this or the direction someone is planning to take us.
How much of this, Monica, do you talk to as sort of a group versus talk to the individual? So like, I have the thought of, do you mention to the doctors just in general and say, hey guys, I can carry more of this medication, or we can, I noticed that we're going through this medication. I'm happy to have it. I just want you guys to know that it is significantly more expensive for the pet owners than the other medications that we carry. Again, if they need it, then they need it. But I just want to let you guys know, one, it is more expensive, and two, if we plan to keep using it, let me know. Is that doing the thing where you have a problem with one person and instead of talking to that person, you're going to the whole team? Yes. Like, is that what that is?
I would say that would be, for me, it was always going to be a case-by-case scenario. And probably what's driving it to bring it up more from a team meeting perspective would be that it's now becoming a chronic issue or a problem. I'm hearing complaints from the team members, from the clients. Maybe the wait time has increased because the individual is taking on 6 additional appointments. So I would have to, once again, take a step back. And sometimes you have to take things with a grain of salt. And then other times, if it's becoming such a great issue, then there might have to be, hey, we need to regroup or open up communication. Maybe there's like a come to Jesus talk that has to be had or something along those lines. So it definitely is a case by case scenario. But I get what you're talking about. Sometimes that emotional response will have a manager or owner making a decision about a complete change in protocol over one instance. And I don't advocate for that, because I think that sometimes can come back to bite a manager, a practice owner.
Oh, yeah. No, I think you're totally right. But I mean, I see that is for people who really dislike conflict, they're like, I'll just send a note to all the doctors.
Yep.
That says, hey, guys, be careful about this medicine. In reality, what happens is the other doctors are like, did I overuse this drug? And it's like, no, it's just the one person needs to hear it. It's just going to go right over their head. They're not going to open the email.
Exactly. Going back to the adding additional cases, you think about 3 years ago, we were expecting that of our doctors, that they got into that mode of being able to do that. And in the question, it said that this doctor was the highest producer. Yeah. So for that individual, always being busy probably is something that he or she is used to. And realizing that, yes, the industry has slowed down a little bit, but if he was a higher producer, he may not slow down that much for him or her. So they are thinking they're just doing what they've been comfortable, expected to do. And now you're going to put the brakes on them and make it maybe feel like they're being reprimanded or, put in a situation where they feel like they're doing something wrong. So we have to be careful as owners and managers that we do have expectations, and switching those on an employee, on a doctor, you have to be careful, because the last thing you're trying to do is cause a rift, and realizing that sometimes they're doing what they think they're expected to do. Yeah. Because your expectations have changed and you haven't communicated that to them, then it's like, hey, let's be fair with this.
I think you're spot on. I think some of the context that would be interesting here is is this new behavior? Did they, have they always taken these cases, and how many have they taken? And sort of what's changed to make this an issue? It might be that the medications and like the high invoices are the issue. And now that we're looking at that, we also notice, boy, this person takes a lot of extra cases or things.
It could be something as simple as the drug that he or she had been prescribing. Maybe it's on back order. He felt like every time he tried to prescribe it, they didn't have the full amount. And there's rhyme and reason to everything. And I think sometimes we're just quick to judge or pass judgment. So,
oh, yeah, there's this sort of spectrum of performance that we want. And it's so funny. We so often see people saying, how do I get the vets to see more appointments? How do I get the vets to take extra cases when they come in and not complain about these unscheduled walk-in appointments or whatever? And then you get a doctor who's like, I'm taking all of them. And you go, whoa, we got to calm this down. And you do. Like there's, you can be off on both sides. Just like we would have concerns about doctors not practicing up to our standard of care. Right. I do think we should also be a little bit wary of doctors that are practicing over and beyond sort of our sort of acceptable standard of care, and just sort of, but you really have to be careful in how you do that. We want to be supportive of them. And I also really like the fact that this practice says, we let our doctors choose their drugs. And I go, well, to me, that's sort of a must-have for a job, is I want to have the autonomy to look at the case and make the call of the medication. But I do think that I want to make sure that I'm being responsible with what I'm doing, and kind of following suit with the other doctors. And I don't know, I think also, when I think about the impacts and sort of fallouts of these types of behaviors, Monica, one of the impacts that I see is I don't want one doctor that's playing an entirely different game than the rest of the doctors. Yeah. So you go and you see our 3 other doctors and you have a fairly consistent experience. Yes. And then you go see this last doctor and you have a wildly different experience. I think that's probably bad for that doctor. But if you see the doctor that's practicing at a different level of care, or, a different level of aggressiveness or technical acumen or whatever, if you see that person first and then you see the other doctors, it may damage trust in them. Somebody's not on the same page, I think, is the message that gets communicated. And so I think that's probably detrimental in the long term.
Especially if you're in a multi-doctor practice. We never played Big Brother with our doctors, but we did have monthly meetings. We would review cases, and my message to them is that we are one practice. There are 9 of us, 9 of you guys under this roof, but you have to realize if a pet comes in for a heartworm treatment, because they have 2 dogs, both of them are tested positive. They can't afford to do everything all at once. They see one doctor for the heartworm treatment. Dogs about the same weight. They go about the same protocol, but one invoice is, I don't know, $1,500 and the other is $700. It's like, well, did they take better care of the dog at $1,500, or did they price gouge? And then, are they missing something? So there was a level of continuity of care, I guess you could say, as far as consistency and how we worked up cases. That was the expectation, simply because, yes, we had a multi-doctor practice, but we were still one practice. And there had to be some element of understanding that the medicine was going to be similar. And we would come up with protocols, but it was a collaborative effort. So the standard say, for example, our owner would go through and perform a comprehensive physical exam with all of our doctors. And we had seasoned doctors. Things have changed since I was in private practice. We usually require doctors to have 5 years of experience. Now, in the climate, you obviously have to adjust what your requirements are. But my owner, she would perform the comprehensive physical exam and say, this is the standard for our hospital. If you want to add to that, that's fine, but you can't go below, because we want to say that if you're coming in for a comprehensive physical exam at our hospital, this is what it is. And you as a doctor will know that your colleagues perform that, obviously the basis or the basics of that standard, and then you could deviate from that. I think that it's very important to make sure that that's articulated as far as the onboarding, the training of your team members, whether it's a CSR, a doctor, that this is what we're trying to do here. It's not that we're trying to play big brother, but you have to realize in a multi-doctor practice with, I have close to 100 employees, we have to have some type of consistency of message so it doesn't, in my opinion, lower the perception, the confidence, and the trust that we're, hoping to instill upon our client base.
Well, I love that phrase, continuity of care. I think that's probably what I would really sort of lean into is like, I want to make sure we have continuity of care, meaning people are getting fairly consistent experiences across the doctors. I think that's a good non-judgmental way to talk about it and say, I'm not saying what you're doing is bad. It's not lining up with sort of what the other doctors are doing or kind of where they are. Cool.
Right.
I think I feel pretty good about this. You want to take a break and we'll come back and we'll talk about action steps?
Sure.
All right. All right. So, Monica, let's get into action steps. I guess my thought was with these, I think I would have two different conversations. I think I would probably have one conversation about the added appointments and then probably a different conversation about the medicines. That's probably how I would do it. How do you feel about that?
I think that, you're right. I would probably need a little more context. I'm not an analytic naturally, I don't think, but as a consultant, I have to have more information so that I can properly, guide and advise. But, based upon the information that we received, I think there's a combination of what's going on here, and I would discuss it in a way that would let them know that I am here to be your support. I'm your cheerleader. I've always got your back, but there's something that's coming into the picture that is raising a couple of red flags. And I'm just trying to get a better understanding so that if I have to be the liaison, I can put these concerns or issues to rest or whatever the case may be. The appointments, obviously you're adding on some appointments. Do you feel that that's working for you? I want to make sure that we're taking good care of you, because I know that there was a major issue with burnout, during COVID, and you're truly valuable to us. So I want to make sure that the workload is not becoming too much or you don't feel obligated. So I would, once again, it's the psyche.
I like it.
Getting into what can we do to make sure you're being taken care of. So that's first and foremost. And I say psyche, but as a person who really cares and will fight for my employees, it is sincere. Because I know that our employees are our biggest asset. So I'm trying to get into their heads, so to speak, to see what we can do to understand why they're approaching it from that standpoint. And probably some information is going to come out of that. And then as far as the medications, just also in light of what society is going through with inflation, we're getting some pushback on people being able to say yes to certain care and treatments and workups, things along those lines. And I just want to get a better understanding of the cases, how you're working those up. And have you found something that has worked better that we need to make sure that the team knows about, the doctors know about, just to get a better understanding. So once again, I would approach it from bring me into your world so I can have a better understanding of why you are approaching your days the way that you are. Yeah. And if it's something that's truly out of feeling obligated, being the team player, doing what he or she thinks is appropriate, then I got that. But if it's something that it may be like, I'm going to be honest with you, Monica, I have a high school senior and all I can think about is having to put this child through college.
Yes.
So, it could be something financially that they understand on the pro-style method of compensation. It's not necessarily charging more for an invoice, but doing more, seeing more. That's going to help you generate more income. Once again, just getting a better perspective from, what's making them run and operate the way that they are.
Yeah,
so that would probably be the first step, just conversation, dialogue.
Yeah, I love that. So I love how you put like, hey, is that working for you? And I want to make sure that we're looking out for you. I think that that's fantastic. I think I would probably go from there. I think it's a perfect starting place. I think the second place would be sort of start to talk about, after I've sort of talked to them and really listen to them and kind of where they're coming from, I would try to convey the concerns that I'm hearing and say, well, this is some of the concern. This is sort of the concern that I'm hearing, or I'm starting to worry a little bit because I'm starting to hear some things about this or the workload or whatever. But I would have a clear sort of why of what are the concerns. It's not you're seeing too many pets. That doesn't make sense. It's, hey, the staff is feeling a lot of strain, the end of the day. We're having people who are staying late because maybe you're able to wrap up and get out of here, but the support staff is staying late to do treatments or to wrap up or to discharge or whatever. And I just want to be able to accurately communicate sort of what other people are experiencing. I remember being a young doctor too, and just kind of not having a very clear picture about what other people were doing. I was so focused on what I was doing and getting into the room and, and making the plan and doing the thing. I didn't really process how much time my technicians were taking, like actually administering the care. Like they just kind of disappeared with the pet out of my periphery. And I was doing the next appointment. And again, it's sort of a self-centeredness, but it's it's a naivete of just being very focused on what you're doing and just not being aware of other people. And so I try to sort of communicate that to them. I really like the plan of trying to communicate. This is not a big deal. I just want to talk to you about it and work through it. I think one of the big parts here is hopefully this has not gotten to be a big deal. Hopefully we're saying something early enough that it's worth saying something. Like if I'm starting to get complaints from the staff, especially more than one, it's probably worth me talking about it. But not so much, hopefully, that people are threatening. If he takes one more case, I'm going to quit. Hopefully we're not at that point. And so it shouldn't be that big a deal, but we do sort of need to talk about it. And then I kind of got to do my homework here. Is hopefully before I talk to this person, I've looked around a little bit. I've kind of looked at the inventory, for example, and say, why do we have stuff that's back ordered? Why is this happening? As far as like taking the extra or the walk-in appointments and everything, what is our protocol on here? What are the alternatives? If we don't take these people, what happens to them? Where do they go? Do we have a plan? And if we don't have a plan for what we do, if we just can't take any more cases, well, I'm going to walk in there and the person's going to say, well, I hear you, Andy, but what am I supposed to do when these clients of ours show up and they need help? And like, I want to have an answer because I think that's a very valid question. So as much as I can sort of try to do my homework and think about what I'm walking into before I have the conversation, I want to do that without scripting what I'm going to say. I've seen people do that, and that's a mistake. I really do want to hear what they say and adjust to it.
Exactly. No, I do feel that it's very important there's so many moving parts when it comes to running and operating a veterinary hospital or just being a part of the team. I think the way that I see a situation is there was this video or something that I was watching, and so like if you're in, say, a public restroom and say like at the airport, because we do a lot of travel. Okay. And, some of those big stalls will have the toilet and a sink in the stall, at least for the women's restrooms. So if you're standing there and you see someone come out of one of those or come out of a stall and they leave, you're like, why didn't they wash their hands? That's gross, right? Yeah. But then, obviously, they didn't wash their hands at the main sink area because there was one in the one that no one could see. And that's where when I say you've got to get the entire picture, the understanding. Why is the staff or the team feeling this way? Is it because it's more of us being short-staffed? Yeah. That's what's making them feel overwhelmed about the 6 additional cases or whatever the case may be. Looking at there's so much that this is what I love about being former practice manager, that I love problem solving. Yeah. And my thing, and I think what allowed me to be so passionate about managing, was that I would be able to be that beacon of hope that when things weren't going as they needed to be for my team, for my clients, patients, or whatever, that I could take all of the scenarios underway and then, have a chance to take a step back and just say, this is the issue. But these are the possible options or solutions so that it is no longer an issue. And another thing with a doctor, I would say that I learned this the hard way, that, if you allow a doctor to pad invoices and to do certain things that are unethical, my thing is, are they doing that because you would assume they wouldn't do it? And, a lot of times managers and owners would say, well, common sense says you shouldn't do that. I am not saying any of the folks that we hire in vet med don't have common sense, but I do tell my owners and managers, pretend like they have no common sense. Yes. Your job is to tell them everything so that they can assume nothing. So actually the first step would be with my new doctors, onboarding them. The expectation is that we do not pad invoices. Yeah. We do not, try to dog or hog appointments. That's not how we run and operate here. So you've got to let that expectation be known right out the gate. Yeah. Then if it does happen, You have a talk, a counseling. If it continues to happen, that's a performance issue. And have I terminated a doctor for padding invoices and being money hungry?
Yeah.
Yes, I have, because the expectation is that we don't do that, and doing it, that's insubordination.
Well,
So,
and it's damaging to the practice. It's damaging to the reputation. It damages trust of the clients and the pet owners. It's demotivating to the staff. They don't want to work for a place that's gouging people for money. They want to work for a place they feel like is doing good in the world. I think that you're so spot on. One of my big sort of action steps along here was it's to some degree it's setting expectations. I was really thinking about that with I love that you said about sort of padding invoices. I was thinking about that as far as taking the walk-in appointments or things like that, especially if this doctor's taking all of the walk-in appointments and nobody else is getting any, and they're kind of standing around. I would say, if Stephanie Goss was here, she would say, what does your handbook say? What is the protocol? What are the expectations about how these cases are supposed to be handled, divvied up, taken or not taken? What are the expectations? Because if everybody's freestyling and you have one person who's, look, to your point earlier, someone who's not interested in standing around. They're like, look, if it comes in, I'm just going to see it. I'm not waiting for other people. I'm not pushing people out of the way. But if it rolls in, I'm going to grab it and go. If you haven't clarified that there's some system in place that distributes these across doctors, and then they're assuming there's not a system, and they're setting their own expectation, which is, I'm here, it comes in, I'm grabbing it. And boy, there's a lot of benefit to that mentality sometimes. I like having doctors that I work with who are like, let's get this stuff done and just go. I get it. When you get big enough and you have multiple doctors, we need a little bit better systems and things that are going to make things more sustainable. But at least getting started, having a vet who's just bring them in and let's get them done, that's a good way to go through the day, and it gets a lot of pets taken care of, and it's good for the practice early on.
Yeah, and I would say that a lot of times it's having a better understanding of how that doctor is innately, or like their training. Maybe we brought in a new doctor that came from emergency care or urgent care, and that is what they're used to, and they actually like being in those high volume, busy environments versus someone who, I don't know, maybe was at the vet school and just remembers seeing 1 or 2 cases a day. And that's, taking on more is just something that causes them more anxiety than the doctor that is willing to say yes to everything. So I think that all of us managers are in vet med, working with people, having a psychology degree.
Yeah.
That would help to
Super
understand that we all work and operate just because of innately how we are and past experiences that, sometimes if you don't understand that or have any insight into that, it may seem like it's wrong or different, but that's the beauty of working with folks in our industry, that we're all wonderful and we're all different. And that makes us, the wonderful people that we are.
Yeah. No, I love that you said that. I have a question for you. So if we're thinking about the sort of potential padding of the invoice sort of problem here, whenever I start to try to hold someone accountable, part of what I want to do is come up with some objective measurements and sort of say, this is what we're measuring. This is how we're measuring progress going forward. But I look at this case a little bit, and padding the invoice seems sort of subjective in some ways. Like, is somebody like, are they padding the invoice, or are they, or are they sort of working up the case, and where is that line? And I think that line can be kind of hazy. Monica, how would you measure this? You say, we have a conversation about it and say, this is the perception, and we ask them to sort of help us out and to sort of talk about continuity and consistency of care and things like that. But then the person sort of continues on, and I can't really, how do I measure if they're making adjustments or not? Have you got an idea in your head of sort of how you quantify that?
Well, being that I'm not a DVM, I can play the dumb.
I like it.
Really, I didn't go to vet school, and getting a better understanding of how you're working up the cases, that's just helping me learn and to learn more about veterinary medicine. Now, as a medical director, he or she being a DVM, they would have, to say, if you didn't do this, that may be considered negligent. But for you to order, let's just say if it's an ultrasound, an abdominal, and by the time that patient is done, they needed to have an abdominal ultrasound, but lo and behold, they also had a thoracic, they also had a cardiac. Like, why did they need 5 ultrasounds when one would have done it? So for me, it would be, I would just play like I really don't know, which in the case that I'm not a DVM, just explain to me. I need to get an understanding of why this was worked up the way that it was, so I can understand. And if there's something that sheds light on, maybe they were padding the invoice. For us, we had medical care plans. So say, for example, we didn't do cherry eye procedures regularly. They were just like pyometras. They would come in randomly. But if you saw it only twice a year, instead of having to figure out, oh, this is how I need to prepare an estimate of costs, we had a medical care plan to say the doctors had worked on this. This is what we feel how you should work up a pyometra case or a bill for a cherry eye procedure. That was kind of like our foundation. So if you were doing 10 things over and beyond what was considered our standard of care, then the doctors would go and explain, this is why I had to do that. And if that explanation with the owner or medical director just didn't resonate well, and I would imagine there are sometimes, it's probably very far and few between, but it does happen that someone is ordering more than they should. I know that with a new grad, they're doing that because they don't have the confidence, the training, the skill set, say as a seasoned doctor as you. They rely on diagnostics a whole lot more than you typically are going to find with a seasoned doctor. Is that wrong? I'm going to say in many cases, it's not wrong. It's just they are learning and they're utilizing what they've learned in school, where sometimes we have our seasoned doctors that should be ordering that ear cytology and they're smelling the ear and says, oh, it's bacteria or yeast infection, where we know ordering that cytology would be appropriate. So once again, I think it's weighing things and realizing that padding invoices, it may be perceived that it's padding an invoice, but it may be medically prudent that they have worked up the case that they needed to work up the way that they needed to work up. And there's nothing wrong with that. But if it does come back that they have done something that appears to be malicious, then I think that needs to be handled and addressed as well.
Yeah, no, that totally makes sense to me. I feel like this is a good plan. I mean, I think that's how I would kind of start off with it. I think you really kind of have to wait and see what you find when you look into your systems and your protocols and your investigation of kind of what's actually happening. And then what does the person sort of say and what's your conversation with them like? I think you and I are in alignment of, you have the first conversation and you really try to understand and we'll sort of see how it goes. And, and then if we continue to have problems going forward, this is something that we start to talk more directly about, and then it becomes a performance issue. And that may be something where we say this may be a values misalignment for our practice, but it may end up there. Is anything you would do sort of to wrap this up? Any follow-up that you think is important?
Well, I would just say that, being in a private practice and now as a consultant, there's over 30 years of working with doctors on the ProSal method of compensation. So I've had to deal with serious scenarios like this. And in all honesty, I think that I can feel comfortable in saying that in any situation that you have where there is a perception or a concern, it is seriously for my managers just trying to get the big picture. It's almost like being a consultant. You're having to be that DVM or that consultant where you are getting all the information that you can so that you can make a decision that's going to be appropriate, that's not going to cause a rift with the staff, that ultimately is going to solve that issue. And I would say always approach it from that standpoint, that it is almost like you're putting on your investigative hat and you are investigating and then being able to make decisions or change protocols or do whatever needs to be done in a way that you could say, I have dotted every I, crossed every T that I possibly can to make sure that I am doing and making decisions that are not going to cause any more harm or hurt, that are not going to cause any more issues or problems amongst the team. So that's how I approach everything that I do when I get a call from a client, when I was managing. And I think that's just over the years of being a very emotional person, realizing you've got to just take the emotion out of the equation, Monica, and think of things rationally.
I love it. I think that's great advice. Monica, thank you so much for being here and talking through this with me. Thanks for tuning in, everybody, and listening. I hope you guys have a great week. Take care of yourselves, everybody. And that's what we got. Guys, thanks for being here. Thanks to Monica for joining me and going through this episode. If you get a chance, come and see her on October the 29th, virtually, the Uncharted GSD Financial Summit. Guys, it's going to be a great day. You can learn more over at unchartedvet.com. There's links in the show notes. It's going to be a really, really good time. Gang, take it care. I will talk to you later on.